Hi, I'm Jeff Karamaris, and this is Rainbow Ripper Medical. Once again, this is Chantel DeBazier, my office manager, and we're going to try to give you a little bit of an update on what's going on in our little small town of Dunellen, as well as in Marion and Citrus County at this point. It's been several days, if not a week, since we last updated everybody, and we hope you enjoyed the first video. I'm going to turn it over to Chantel now, and she's going to kind of go through what's been going on over the last several days to a week, and numbers changing and such. So,
well, they have drastically changed. When people look at the numbers that are given out online, a lot of them are seeing 2 Dunellen residents. Well, Dunellen actually encompasses multiple counties.
yes, it is.
There is a total of 5, and as of yesterday, that number has gone up because personally we got a positive for a Dunellen resident in the Citrus County side, where they're awaiting the confirmation right now. People think it can't happen in our little community. It can, it is, and it will. We have been still getting backlash on Facebook because we're doing the right thing. The numbers has drastically jumped. Last night, as of 11 p.m., Marion County was at 101. Then you add Citrus County. They were at 72. We're basically we're sister counties. So you have to count both of those in. Levy County, I believe, is at 2 or 3 now.
Yeah, I believe it's at 3 at this point.
And for a small rural community, we all know we go to the other counties to shop.
Right.
Family members in all those counties. The backlash that we're getting is, why are you testing? We're testing for a good reason. The person next door that carries your mail to your door because you're elderly, they might be positive.
They could carry it right over to you inadvertently, not knowing anything, even without any symptoms.
We have a lot of people afraid to go to the hospitals. We were just looking at the bed capacity. Marion County is at 43.50 still available. That means less than half the beds are being utilized right now for COVID. I think we're handling it great by testing, getting people on the medication. We think out of the box. I think we even started one on a new study that just came out.
Right, we just tried one on the ivermectin that's been talked about quite a bit, and we've been using Plaquenil, hydrochloroquine, as well as a couple others at this point. There's availability in our hospitals to take care of patients with either coronavirus diagnosis or symptoms of coronavirus. Not telling everybody to flock to the hospital. We're here for you to test, to evaluate symptoms, to treat if needed. We are a family practice first, and then trying to help out our community at the same time with this testing. Again, we don't want people flocking to the hospital just because of a cough or something similar to that. There are resources out there. We are available, like I said, to test and to help diagnose. And what we're doing with most of our patients is we're actually doing a respiratory panel, which encompasses more than just the coronavirus testing. It checks for influenza, it checks for strep, it checks for different viral and bacterial pathogens that are common or commonly diagnosed respiratory illnesses. We have, I think at this point now, 1 patient that is hospitalized in one of the Citrus County hospitals. She was virtually without symptoms, has been quarantining herself for 3 weeks at home, just her and her husband, haven't gone anywhere at all. And as a result of us testing her, she paid a little bit more attention to her symptoms and sought hospitalization, and is currently being treated, was being treated in the ICU, but as I hear this afternoon is doing much better and is on a regular floor. So we thank God for that.
The Surgeon General prioritizes 1, stop introducing it into the community. 2, test. That's going to stop the introduction into the community.
Right.
It's not just for the elderly vulnerable, it's for the ones that will give it to the elderly and vulnerable. Prepare the hospitals. I believe that's being done locally. I don't think they have enough PE right now.
No, the hospitals.
They're working on it.
They've from what I've understood, they've moved leaps and bounds trying to get the right protection equipment for the staff as well as the patients. So we really do applaud all our local hospitals
Right.
for that.
And social distancing.
Training.
They moved it to 13 feet now.
Right, because the average cough can travel up to 13 feet at a time. So
Yes.
initially it was a couple of feet, then it was 6 feet, now we're at 13 feet.
Yes.
This is an ever-evolving situation, and new recommendations are made all the time, so we're just going to try to keep you up to date with that as best as possible.
It is our lunch hour. Forgive us for the people in the background. I think that this community together, people say, why are you bringing it to our community? No, we're keeping it out.
Yes, we really are.
They
trying
come
to-
in here, they don't get out of their vehicles, they don't have contact with the people in the community. As far as stopping at places and eating, they're drive-through because of social distancing right now.
Right. Same premises with us, trying to prevent the unnecessary
Exactly.
transmission.
We are trying to protect Dunellen as a whole. As a whole, when the stay-at-home order's lifted and you go to Ocala, you go to Gainesville, you go Beverly Hills, anywhere, Inverness, to do your shopping because we don't have it here. Do you want to be safe there? So stop putting people down from coming from other counties, other towns. Because in fact, they are protecting you by getting tested here.
Right. We have had several patients that had virtually no symptoms, and I think I said in our previous video, one we tested just based on travel history that was positive. The symptoms are evolving every single day. We're seeing quite a bit of patients presenting with the loss of smell, loss of taste, and there's been quite a bit of news out there about that. I would encourage you to just really educate yourselves on what's going on. Pay attention to who some of the news is coming from, because there's a lot of information out there, and some of it's great, some of it is
Harmful.
is not so great. So we
had a gentleman in our own community that was on one of those cruise ships that was sidetracked. We had him come in here yesterday, even though he was quarantined and let off the ship. He thinks he may have contracted it the day he left, and he's just now showing the symptoms.
So we're in the process of waiting for that to come back, hopefully this afternoon.
Test results are getting a lot quicker too. I think we have some test results to give to someone today.
Yes, we do.
Is it okay if we tell you on camera?
Sure, sounds good.
Andy, you're not pregnant. No. You are negative for the coronavirus and all respiratory pathogens.
All right. I was pretty certain of that, but seasonal allergies
Right.
get you scared. Being in contact, because we're essential with having to provide internet.
Now, we do have to tell you that doesn't give you super armor. You
No.
could have contracted it the minute you left here.
Yeah. So we're still washing hands. I
That's
keep
right.
number one is washing hands.
Yes,
Number
absolutely.
2 is having the alcohol.
Right.
Number 3, if you go someplace and you're going to be a lot of people are touching, I have some gloves left in my truck that we do, because sometimes we touch things that underneath
Right.
trailers and stuff, so we carry gloves, and I'll put on my gloves. But
Yes.
number 1, wash your hands.
Oh,
Yes.
it's so simple yet so overlooked.
It's amazing that we had to have a pandemic to get people to wash their hands.
Yeah.
We were all taught as little kids sing happy birthday and wash your hands.
Mm-hmm.
The other
Still
thing
works.
is putting your nose, when you sneeze, put your nose into your elbow
Right.
and sneezing into your elbow.
Do not elbow bump people after doing that.
No,
Yes.
no,
Um,
but thank you.
oh, you're very welcome. I'm glad it was.
And it
glad
didn't
was
hurt,
negative.
did it?
No, so I looked at the video and I looked like I was startled. I was like, whoa, that was it? I thought you were going to go further. There was
Nope,
more.
you
I was
don't
like,
need to.
I was startled like, oh, Oh,
If you do
okay.
it gently, you're actually getting the mucus that's coating that where it lives.
Yeah, so that was 100% completely painless.
Good.
I mean, yes, you have a Q-tip in your mouth, but
It's
Quick and easy.
it's
brief
quick and easy.
seconds and
It
it's
was
done.
not what I expected in a good way.
There we go.
I would like to say at this point we're working with some different labs on trying to have the ability to do antibody testing.
Yes.
We've had a lot of people saying that between December and early February they had very similar symptoms, and obviously at that time there was no testing being done, and even that which was done when it first started was very, very limited. So for those patients that are concerned that they may have had it at some point and just really want to know the answers to what's going on and what went on with their health, we hope to have that available pretty soon.
I think we already started the clinical research on that part.
Yeah,
And
yeah.
I believe somebody is the primary investigator sitting next to me.
No. Well, we are definitely working on that, and we'll keep you updated on that as time goes on. But just want to thank our community, thank Dallas TV, thank really just all the businesses and our patients and all of our community members, and the chief here
Yes.
in Denellen, as well as his team for watching out for us, taking care of us, and allowing us to serve our community.
Yes, I felt very safe. They've been watching us
Yes, they have.
and taking care of us,
Yes, they
so people don't try to run us over anymore.
And do you mind me letting people know that other people are taking care of you?
Oh,
I've
yes.
seen 2 pizzas delivered today.
Yes.
Actually, one of those is from an old city official here brought some by,
Yeah, yeah,
and another one was from our positive patient.
yeah, yeah. So it was, they were both surprised, and we're very grateful and thankful for them trying to help take care of us during this time.
I think they've taken better care of us than we ever have each other.
Probably true. Probably true. So thank you all.
Thank you.